OCD can target your religion. Religious OCD is also known as scrupulosity. It's an OCD-themed subtype where you experience intense and distressing intrusive thoughts, fears, or doubts about your religious beliefs. Religious OCD can feel confusing, and make something that typically would be a source of comfort feel like a source of stress and anxiety, which can add to the distress experienced. Religious OCD obsessions might sound like fears of having had blasphemous thoughts, or if your thoughts could be considered sinful or blasphemous. Experiencing unwanted and intrusive disrespectful thoughts about religious figures or religion and worrying about it. Worrying that you might have committed a sin. Repetitive, intrusive and unwanted doubt about your religious beliefs. Overwhelming fear of going to hell. Fear of having offended God. Perfectionism about worship. Religious OCD compulsions might sound like excessive prayer, compulsive repetition to reduce distress, or repeating prayers or religious rituals until it feels just right. Repeatedly confessing or seeking reassurance about the same minor or non-existent sins. Avoiding things that trigger intrusive thoughts or doubts. Ruminating on doubt, trying to resolve them or reach perfect certainty, or mentally reviewing your memories of past actions. Creating excessive personal religious rituals or being excessively strict about doing them correctly. People with OCD perform compulsions to reduce the distress and doubt caused by the obsessions. Unfortunately, the compulsions only offer temporary relief, and the distress is likely to return or turn into a new what if after each compulsion. Thankfully, a trained OCD therapist will be able to identify and help you navigate your religious OCD. Religious OCD can be treated, and the gold standard treatment approach is ERP, exposure and response prevention therapy.